And this is the second hour of today on eNCA. DSTV Channel 403, I'm Yuveka Rangopal. Good morning. Now, some experts have been scathing of government's COVID-19 vaccine plans. They accuse it of acting too slowly and beginning negotiations with manufacturers too late. They say it will be near impossible to achieve delivery by February or to inoculate the targeted two-thirds of the population by the end of the year. Well, let's find out more now from the Health Department's Anbin Pillay. Anbin, a very good morning and thanks so much for your time. So help us understand, for anybody who missed the update last night, just what has changed from the last time when we were told by health officials that we would get this vaccine, or we hope to have it by, say, April this year, that now we're hearing that we're working to get this in Feb. What has changed, and why wasn't there that sense of urgency, if that was the case, before this, to maybe try for Feb?
So are you probably referring to the speech that the President gave in his last address to the nation? And if you look at it very carefully, it clearly states that the COVAX facility has indicated to us that they are likely to deliver stock to us in Q2. However, we're in bilateral negotiations. And as those negotiations are firmed up, we will then make announcements about that. And yesterday's indication was where we are currently in terms of those bilateral negotiations. COVAX hasn't come back to us with a firm date earlier. However, they are trying certainly to get us stock in the Q1.
All right, so the goalpost seems to have shifted. They might be able to do this sooner for us. But just experts who've reacted to what we were told late yesterday and been saying that, you know, like you say, there needs to be all these bilateral arrangements after you've had your negotiations with these manufacturers. Those arrangements need to be put in place, and there doesn't seem to be nearly enough time for those arrangements to be put in place to make February a realistic delivery date.
Well, let me say firstly, the experts that are talking about us being late, I'm not really understanding what they mean, because we started in September. I heard one expert saying we should have started 6 months ago. September is about 5 months away from now, so I'm not sure when they would have thought we should have got into discussions. But we've been in discussions with all of the companies from September last year through to now. The issue at hand, and we made this point here last night as well, is that when we were presented with the options from the different companies, we had a number of uncertainties. The most important uncertainty was there was no firm delivery date. We did not know when the vaccine will be approved and when we'll get the vaccine. The second is obviously the risk-taking that we've mentioned, where we'd be getting into a risk-taking arrangement. We had to pay a deposit with all of the suppliers, and nobody was prepared to talk to us otherwise. So those are the circumstances that we were faced with in terms of getting into the bilateral agreements. That's why we chose the COVAX option. But as I was saying last night, the COVAX option didn't take the Pfizer vaccine on board. Now, Pfizer was the first vaccine to come out of the regulatory process. And so those developed countries that were able to afford the Pfizer vaccine and have the minus 70-degree fridges bought those vaccines. You'll find many developing countries have not bought the Pfizer vaccine for the same reason. They would not be able to store or administer that vaccine. And they're all waiting for the other vaccines that are coming through fairly soon, such as the AstraZeneca, Johnson & Johnson, etc. So
just clarify for us, we're one of those groups that doesn't have the proper storage systems for these vaccines?
Most countries in the world don't have storage, minus 70-degree storage facilities. We have two commercially available storage facilities. The UK, for example, had to buy over 250 of these kind of fridges and install them. It took them several months to do that. Remember, the UK funded the trials before they actually started, so they were fully aware of what they were paying up for. So they had started somewhere in March. That's when we had our first case, you know. So this was a very different scenario to where we are in terms of this.
So you are in direct talks with Johnson & Johnson, am I right, as we know, and they are conducting their trials here in South Africa. So where does that put us in terms of the waiting list for this? How much more available does it make their vaccine to South Africa, because those trials are being held here? And are you using that to our advantage?
So we're in talks with Pfizer, we're in talks with AstraZeneca, Johnson & Johnson, we're also in talks with Moderna, we still are in talks with Moderna and the other companies that may come through thereafter. Now, coming to your question about trials, Well, there is no legal obligation on companies to put us first in the queue. However, we do appeal to them that we contributed significantly to the benefit of the product through the trials and the data that went into that, and we would therefore appeal that they provide us with the product. No one said no, but at the end of the day, we still have to get an agreement in place with them in order to have access to the product.
I suppose, and while many of us want to be optimistic and many of us want to understand that there is a process and that we are not one of the wealthiest countries in the world, far from it, and we have Professor Abdul Karim telling us that it was the richer countries that were able to get their hands on this, and we are really naturally fall to the bottom of the list. But we knew this when we were talking about vaccines, a couple of months when we realized just what was happening with this pandemic, what was happening with COVID. So why didn't we foresee this? Why didn't we plan for this in terms of money, and why are we trying to raise the money now? And I'm just asking basically what I'm hearing around, lunch tables or whatever this, whatever conversations are happening at the moment, and why aren't we pushing? Why aren't we being a bit more vicious in terms of saying we want our share, because it's just as urgent in South Africa as it is in the UK or the US?
I think it's difficult for the public to appreciate what's happening in boardrooms, but clearly within those meetings that we're having with each of the pharmaceutical companies, we are very assertive. We talk to each of them almost every other day, trying to follow up on our requests and appreciating that we have a serious pandemic here, as well as a high prevalence of the variant as well. So we really need to get our vaccine program up and going. In terms of us doing anything differently, if we had got into an agreement today with Pfizer, for example, that vaccine would not have been able to be rolled out, as I mentioned, because of the -70 degrees. Only a very small proportion of the population would be able to access that vaccine. So the other two vaccines that are globally available is a vaccine from China and the vaccine from Russia. And those two vaccines would not pass the regulatory muster that would be required for South Africa, as many other countries have not accessed that vaccine for the same reason. So those are the only three vaccines available. So when the AstraZeneca vaccine becomes widely available, or the Johnson & Johnson vaccine, then certainly you will see that many more countries will access that, including South Africa.
Well, there's also some hope maybe placed on the African Union now being tasked with negotiating, I think it's with the Serum Institute of India, if I'm not mistaken, which is making a vaccine on behalf of AstraZeneca, and we know that our very own president is the chair of the African Union. So, Anban, where are we with using that to our advantage as well?
So the president's role in the AU is to try to secure doses for the entire continent. Part of the continent will be supported through COVAX, but there are about 7 countries on the continent that are going to self-finance. They're very much in a similar situation that we are, and so the president has been engaging with a number of companies to say, you can't leave this continent behind. And so Serum Institute will certainly be producing for AstraZeneca, and we anticipate that our doses of AstraZeneca vaccine will probably come out of the Serum Institute, given the volumes that they produce of this vaccine. They're also engaging with Pfizer as well. I think that announcement the president made as well, and Pfizer will also be confirming when they would be able to release doses to the African Union, because they obviously don't have any stock currently.
And I think what's going to help your case in terms of quelling the anger and frustration out there is to give, I suppose, South Africans more regular updates. That's what they need. They need to know, I suppose, every couple of days, how close are we? How close are we to this February deadline, or to what's being promised? Can you make a commitment to actually do that, to let South Africans know as soon as possible how realistic that February delivery date actually is?
I think the minister made that commitment yesterday. I understood that the public are very keen to understand that. I think we need to share that information in the context of the non-disclosure agreements that we have with companies, so we can share some information, but not everything. But certainly we will try to share as much as we can going forward.
All right. Well, thanks very much for that. And I suppose we have to look forward now. That's what we have to do. Whether we feel that government dropped the ball or it didn't, or whatever the story was, looking back is not going to help us. Thanks very much just helping us look ahead there. Department of Health Dr. Anban Pillay. Well,